All right. Hello there. It's nice to have you join us again on Close Flow, where we engage in conversations that shape the society at large. I am Kazim Adeyemo. You can watch all our programs, including Close Flow that you're watching now, streaming live on our website, www.nta2.tv, and on all our social media handles on Facebook at NTA2 Lagos Network Center, on Twitter at NTA2LNC, and on YouTube at NTA2 Lagos. All right, health is wealth. The importance of the health sector in the scheme of things anywhere in the world cannot be overemphasized, based on the fact that it is when the citizens are healthy that they can contribute their quota to the socio-economic development and political development of their country. Today on Close Flow, we shall be taking a critical look at the health sector in Nigeria. What are the challenges and how they are being surmounted? And of course, the way forward. All these and more we shall be looking at in our engagement today with a scholar, an academician, a researcher, and a professor of note. You will meet my guest shortly when we return. Please stay with us.
Hey beautiful, your eyes, your smile are all begging me to take you home tonight. Now reading page 3. Experience unlimited superfast internet access from Entel 4G. Entel. Live more. Experience unlimited superfast internet access from Entel 4G. Entel. Live more.
All right, welcome back. Today, I'm profoundly honored to have with us on Close Flow a professor of obstetrics and gynecology, a consultant obstetrician and gynecological surgeon with the University of Jos Teaching Hospital in Plateau State. He is a fellow of Medical College of Obstetrics and Gynecology, a fellow of the Nigerian Medical Association, a fellow International College of Surgeons, with other qualifications in management. He is a member of the Nigerian Institute of Management and, of course, a member of the foremost Institute of Policy in Nigeria, the Nigerian Institute of Policy and Strategic Studies in Kuru, Jos Plateau State. He is a member of the National Institute, NMI. In addition to that, he is a foundation fellow of Nigerian Academy of Medicine. He is the sitting Vice Chancellor of the Federal University of Health Sciences, Otopo in Benue State, the first ever Federal University of Medical Science in Nigeria. Join me to welcome Professor Innocent A.O Ujah, MD. Prof, pleasure to have you join us on Close Flow.
Thank you very much and good morning.
Thank you, sir. Going through your profile, Prof, honestly, I must confess you have an intimidating credentials, honestly, and a commendable one at that. I mean, you've been in your 31 years of active practice in medicine.
Hello.
You've contributed so much to medicine in Nigeria and of course internationally. Once again, thank you so much for joining us.
Thank you very much for having me. I'm delighted.
Thank.
I thought you would add that I'm the president of Nigerian Medical Association.
Say that again, sir. All right,
I said
sir.
I thought that you will add to the fact that I'm the president of Nigerian Medical Association.
Oh, sorry for that grave omission. Of course, he is also the current president of the Nigerian Medical Association. So we are going to talk a lot about that. So there's so much issue around that. So once again, Prof, thank you for joining us on Close Flow.
Thank you.
All right, sir. Prof, I want us to
you.
start this on a lighter note. All right. I mean, there seems to be a preference or more attention, as it were, being given to gynecology, which is your specialization. Gynecology, that has to do with female reproductive health, as compared to andrology, which is the male reproductive health issues. I mean, as a man, Prof, as a man, you know what I'm talking about. Why gynecology and not andrology, sir?
Well, thank you very much.
All right, sir.
As you know, gynecology also deals with andrology.
Oh, okay.
But the beauty of it is that these are people that the gynecology and obstetrics will have to focus very seriously, because the women bring up life, even though it takes two to make a pair.
That's right. That's right. That's right. We can't. The importance of that, gender to nation building and, of course, to sustain humanity cannot be overemphasized. That is well noted. I just thought we should also, take a look at what also concerns us as male. All right. Moving on. While I was going through your profile, Prof. Something caught my attention. Okay, and this I also found out that some of your members, have concerns also in this area, and it is the fact that you are the sitting president of the Nigerian Medical Association. I mean, everybody knows that that's one of, if you like, a pressure group or a formidable trade union in Nigeria, as it were. And at the same time, on the other side, you are also sitting as the vice chancellor of the first ever medical university, federal medical university in Nigeria. Talking about Federal University of Health Sciences in Otopo in Benue State. I mean, this is sitting at opposite ends, because at some point you will have to defend the interests of the government, and at the same time you want to also defend the interests of your members as president of NMA. Prof, isn't this obviously a conflict of interest?
Hello?
Did you get that, Prof? Did you get that question?
Sorry, I didn't get the last.
Okay.
I didn't get the last bit.
All right.
I was sitting on both sides.
Okay. Yes, I said you are sitting on both sides of the divide, the opposite divide, so to say. I said, isn't this obviously a conflict of interest?
Well, unfortunately, let me just say this: Nigerian Medical Association is not a trade union.
Okay.
Nigerian Medical Association is a professional body of repute,
Okay.
the noble profession of medicine.
All right.
And we need to get that clearly.
Okay.
You will recall that Nigerian Medical Association is to ensure that the health of Nigerians is preserved and protected. Now, the issue of vice chancellorship and the president of Nigerian Medical Association, I must say you are not alone in this confusion that people face. Now, I want to say that Nigerian Medical Association, under my leadership, is not there to fight government. It is there to work with government. And we do that through negotiation, through dialogue, through advocacy, through constructive engagement. And being a vice chancellor, it's also a positive addition to that position because I would call it alignment of interest rather than conflict of interest because there shouldn't be, particularly that my university is the first ever medical university of Nigeria, established by the government of federal government of Nigeria. Therefore, we'll do everything to synergize our views, our opinions, and policies to move the health of Nigerians forward. So the long and short is that there is no conflict of interest. Rather, there's alignment of interest.
All right, Prof. I want to stay a little on that before we leave that side. Okay, you said NMA is not a trade union group, as it were, is a professional association. No doubt about that. But at some point, we know that there are issues that NMA want to trash at some point with the federal government, though there seems to be a quiet, in that side for now, but at least not too long ago, especially during the COVID-19, the height of it, we saw the National Association of Resident Doctors, calling their members out on strike severally for one issue, or the other. So at some point, there will certainly be, the time where your association, your members want certain issues to be addressed by the government. And when they are not satisfied, they call, their members out on strike, which has always been the case. Okay, well, maybe you are bringing in something new to the table. But that is a part. Some of your members, who are your critics, they are also of the opinion that you, like I said, sitting on both sides now, there's no way that their interest as a professional body, as you put it, will not be jeopardized, or at the very least, that their interest will not be weakened under your presidency. Would you say their fears are not are baseless, or how would you react to that? How would you react to that, sir?
Let me just say this. Yeah, let me say this, that for the past 20 years, the Nigerian Medical Association has not gone on strike, and there's no reason for that. However, National Association of Resident Doctors, which is an affiliate body, one of the 9 affiliate bodies of the Nigerian Medical Association,
Okay.
had gone or threatened to go on strike for justifiable reasons. And the Nigerian Medical Association, as the father of all, will try to moderate and temporize. And that's what we've done over the years. Now, let me also tell you that those who probably have fears do not know how government works. Fortunately, I have been in government for a while. I was the Director General of the Nigerian Institute of Medical Research between 2010 and 2016. And while I was there, I actively was participating in the Nigerian Medical Association activities, including being chairman of its committee of Nigerian Medical Association. The truth of the matter is that we need to reorganize and reprioritize and be innovative in our strategic options.
Okay.
I.e., we do not necessarily have to go on strike. We negotiate with government. We advocate the government because the feeling that probably people have is that whatever we think we are saying, the government fully understands. No, we need to sit down and discuss this. And that is what we call constructive engagement. In that case, you find that we will get the best. You see, if we fight and you go on strike, that is the end of the process. You go to your armory, I go to my armory. The grass suffers. And we don't want to do that. I've been enemy for about 40 years. And I have learned the rudiments of processes and procedures, negotiation, constructive engagement, dialogue, advocacy. And I am bringing this to bear on the Nigerian Medical Association. So there will be, in my opinion, and I believe, I'm coming in, there will be a new enemy that will not have to fight any government, but we'll get so much from government for the health of our people and also for the welfare of the doctors, because the doctors deserve to have the best for this country. They are very committed, very intelligent, You can see what's happening at the moment. The COVID-19 pandemic, which has actually brought out the nakedness of the health system in Nigeria. Despite all that, the doctors are on their duty post,
Wonderful, sir.
doing their best, ensuring that they provide for Nigerians.
Wonderful, sir. Awesome, awesome, Prof. Thank you very much. You just mentioned the issue around COVID-19 because I actually was, going to come to that much later. Now, okay, so let's leave that. You have 2 years to do a lot of to bring much of your experiences to bear as the president of NMA. So we'll see how all that will play out in the next 2 years. Okay, so let's move on. Let's move on. Your association, the Nigerian Medical Association, was established in 1951. That's 9 years before the independence of Nigeria. And, just October 1st, 2020, Nigeria marked its Diamond Jubilee, 60 years of independence, which means your association is far older than Nigeria, as it were, independent-wise. So what would you say has been the contribution, or how has your association fared towards, in contributing to nation building?
Well, thank you very much. It is true that the Nigerian Medical Association was established by 1951 under the British Medical Association.
Okay.
And by 1960, we became fully independent, just like Nigeria, as a Nigerian Medical Association. And since then, the Nigerian Medical Association has consistently contributed positively to the development of the health system in Nigeria. If you recall, at the beginning, we had only one university that would train medical doctors, and that was the University College Ibadan, which eventually transformed to the University of Ibadan. At that time, too, shortly after that, we had just probably 3 or 4 universities: Ahmad Bello University, University of Nigeria and Nsukka, Obafemi Awolowo University, and then it was University of Ife. And after that, we have over 72 federal institutions, health institutions, and over 32 medical schools.
Hello, Prof.
At postgraduate level.
Okay,
now
go on, sir.
Now we have the National Postgraduate Medical College of Nigeria, which trains. So in that wise, the capacity building for doctors under the auspices of Nigerian Medical Association and medical profession has grown from leaps and bounds, in leaps and bounds. And I think that in terms of development, even while the
Wow. Hello, Prof.
The health services
okay.
Nigeria has improved over the years, and we can do more. It's not the best as it is at the moment.
Okay, thank you very much, Dr. Prof. Beg your pardon. Thank you very much, Prof. In 1951, towards the independence of Nigeria and all of that, we didn't have much, as it were, foremost, training institution, medical college to train our doctors. Yet the few ones we have then and the few medical, government hospital around there, they were centers of excellence. That attracted, expatriates from other countries to come, to want to work here. And of course, even patients were coming from far and near to take advantage, to access medical services here in Nigeria. The same cannot be said for today. Rather than having that, most of our people, our citizens, they are even going out of the country on medical tourism and pilgrimage, if you like. And that also puts a burden on our currency, because they have to demand for dollars to be able to access all of these. Prof, how did we get to this point?
Well, unfortunately, one of the greatest tragedies of development is instability. And you recall that just shortly after independence, just about 6 years, Nigeria had its first coup where there was a military takeover. And between that time, that 1967 up to 1998, the military was in command. Apart from the 4 years of President Shiv Shagari between 1979 and 1983. Therefore, you recall that the government run by military establishment, they have no rules. They are not guided by any procedure. They are not guided by any process. So despite the fact that the capacity is being built, the political commitment is not there.
Okay.
And we were just wobbling from one point to the other. In the process, we lose so many things. For instance, you look at, despite the fact that Nigeria was doing very well, in 1986, there was the devaluation of the naira. The policy of government at that time was such that Nigeria was brought to its knees in terms of foreign exchange. And I think that that negatively affected the system. By early 80s, by 1970 and 80s, you know that Ghanaians were running to Nigeria.
That's right.
Some of them came to support and train in Nigeria. But today, Nigerians are even now running to Ghana to train in the medical schools. It is obvious that something is not right, and we need to put it right. And the most important thing is political commitment. And we need to show some level of leadership. Probably that is not good enough. And I think we need to rejig our commitment, our political system, and political commitment to the healthcare system. Health is wealth, and you
Indeed.
cannot just wish it off.
Indeed.
Unfortunately, if you look at the budget over the years, budgetary allocation to health over the years is a shameful statement to say that we are not giving that priority that the health is deserved. And I believe that with time, I believe that the government will come to realization that they need to improve budgetary allocation to health. The
All right.
National Health Insurance Scheme that came to be in 2005 is wobbling because of maladministration and corruption. We believe that, and even then, the whole thing was put hastily because it is not the way it is now. Is that if you like, you enroll for the National Health Insurance Scheme. It shouldn't be so. It should be such that every adult Nigerian should enroll into the national health system, because health is very expensive and it's increasingly becoming very expensive. So one of the things that would have happened is that, one, despite the fact that we are building capacities, we need to continually train. You recall that at the level in the 80s, 80s, Nigerians who are doing the postgraduate medical education in Nigeria had to go out compulsorily to train, to look at, to exchange with the developed world, to see and bring home. And unfortunately, politics has removed that, and we train locally. We have to exchange ideas. Medicine is a continuous and innovative process. You cannot stay alone and expect the best. We need to interchange either in teaching, research, and capacity development. Unfortunately, the government currently, in the last few years, this has not been so. And when we say, look, we need to be trained, we need to go for international conferences, let's exchange ideas so I can bring the best home. The political class will not see what we are seeing, and they don't appear to agree with us. It is also true that equipment and facilities that we need in Nigeria are not being purchased or procured.
Sorry,
And
Prof.
even maintenance.
Hello, Prof.
Maintenance is a
Hello,
big
Prof.
problem, so that it will act as if we're dumping ground for
Okay.
equipment. We don't have maintenance engineers in areas of health.
All
And
right.
that also negatively affects the health quality of our people. So by and large,
Okay.
I think
Okay.
it is centralized in
Okay.
areas
Oh,
of
oh,
political
oh.
commitment.
All
That
right,
is where
Prof.
we
Thank you very
need
much.
to
Thank you very
do
much.
further research into.
All
We
right.
also know that even our research capacities are being dwindled, and we do not even accord any priority to research. There is no way a country can grow without, a very sound foundation for research. I was the Director General of the Nigerian Institute of Medical Research, and we were crying for funding, unlike the National Institute of Health of the United States of America. Why should we? And all the researches that we're doing, most of the research we are doing, were after our competitive grants proposal writing. Then we get funding from the National Institute of Health or other funding bodies. But in Nigeria, there's no organization that gives grants for research except TEFOND. And TEFOND is stretched to beyond limit. So these are some of the factors that affect the quality of care that probably prepare people to go out, and they don't need to go out because the capacity is here. All we need is up to date equipment and discipline. Our attitude also will not help us because we are very poor attitude as doctors and nurses and all the other people working in health sector. So we need to change our interpersonal communication. We need to improve on it. People need to know that they are people come to the hospital to get well and not to inflict more injuries to their mental status or their health status.
Thank
By
you.
and large, the political commitment is very important.
All right. Thank you so much, Prof. You've said so much because I was actually going to cut in at some point to ask for, other challenges that bedeviled or bedeviling the health sector in Nigeria. And you have, itemized so much from policy inconsistency to some other issues. Okay, so maybe when we come on, we will be going on a short break now, Prof. Maybe when we return, if you still have more, some of these other challenges, you can still let us know when we return. So we will be going on a short break now. You are still watching Close Flow on NTA2 Lagos Network Center. We'll go on this quick break. We'll be back shortly.
We must dilate the eyes. We look for if they have cataract, we look at the back of their eyes. They have glaucoma. We do a full workup for them.
You will remember
a lot of our government should actually open their eyes, especially southwest of the state.
We're going to be looking deeper than we ever looked in before to ensure that we close all the loopholes.
it manifests as physical symptoms. And
every edition is an arresting conversation with distinguished Nigerians from various strata of the society, bearing their minds on how we can realize the Nigeria of our dreams. Join us live on Close Flow, Monday, every week here on NTA2 Lagos Network Center. Close Flow. The conversation is about you.
All right, welcome back. This is still Close Flow. Prof, thank you for joining us once again.
Thank you very much.
All right. Before we went on that break, Prof, you were, highlighting and itemizing various challenges that, is against the proper working of the health sector in Nigeria. Of course, you mentioned so many things, and you even mentioned the wobbling and the fumbling of the health sector. I mean, the health insurance, the NHIS in Nigeria. And honestly, I have my own take on that too, but I hope we'll be able to come to that in the course of this discussion. But moving on, one sure challenge that also bedeviled this very important sector of Nigeria is brain drain, which is the exodus of our professionally trained doctors here with Nigeria hard-hand resources who, after being trained, before you know what is happening, they are out of the country to give their services to other countries. I'm going to very quickly share an experience. I mean, just last week, I was in one of the federal government-owned public institutions and to see a consultant. And getting into the office of that consultant, I met them, with their colleagues, in the middle of a talk. And it was that one of the nurses there complaining that the job was becoming burdensome, that they were becoming fewer and fewer every day. Many of the doctors and other medical, they are leaving the country, and then, the job is becoming burdensome to the few ones. And she asked the consultant that I went to see, or are you also planning to leave? Prof, you don't want to believe what the consultant said. She said it's just a matter of time. Apparently, her papers are already at work, that as soon as that is done, she's out of the country. And now I'm beginning to wonder, all these are doctors that are leaving the shores of Nigeria. Is it about seeking greener pastures out there, or there is more to it that meet the eyes?
Well, thank you for touching this sore point that is afflicting the health system. It is true that Nigerians are traveling abroad to get satisfaction. It will be thought, people think that it's only money because of money. Of course, money is a factor. But if you look at the history of Nigeria, um, brain drain has been in cycles. Between 1978 to about 1980, there was brain drain. In the 90s, there were most of the consultants that we had, professors, headed for Saudi Arabia. Now we are at it again. The reason is that Nigeria has failed to study why doctors and probably other health workers are moving out in droves. The training of doctors is very, very expensive, and we should do everything to keep them at home. But the contradiction is that the people in government do not even think anything has gone wrong. For instance, you have some consultants who have finished their training after rigorous training in the prescribed medical education. They will tell you that the institution say they have not got approval from the budget office to employ them. Of course, they will go to where they are needed. Nigerian doctors are very well trained. There's no doubt about that. I was trained in Nigeria. I also went to the United Kingdom, and I know the value that we have, in terms of training. And anywhere you go in the world, you see Nigerians putting in their best, but they are not wanted at home. So number one, the remuneration is very poor. That is one. Two, the work environment is very harsh. Three, the equipment to work with is not there. You recall, if I tell you that in the 90s or early 2000, I used to operate with torchlight. You start operation where a patient is under anesthesia, and then suddenly the light goes off. My God, how on earth can this be sustained? And what will happen at that time till today? Not much has been done, but there must be some level of improvement, but not to the level of Nigeria that we know. So the other thing is that you find that when you ask for, nobody thinks that, okay, I've talked about research. There is no priority accorded to research in Nigeria. And that is where you have consultants and professors having to look at what happens in Nigeria and bring out. No, we don't have to wait for WHO or National Institute of Health. When COVID-19 started, the funny aspect that instead of us looking at our own environment and look at what is peculiar to us, NCDC was waiting for WHO whether we should use face masks or not. The Nigerian Medical Association at the beginning said, look, government, please close your borders. Close your borders so that we will contain the coronavirus at the time. The government will not listen to us. Because we have epidemiological characterization of diseases, and doctors, scientists can tell you this is what may happen, this is what may happen. It may not happen, but it's very likely to happen, because that's what we call emergency preparedness and response. So the truth of the matter is that people are not satisfied with the work they are doing. You do mundane things, there's no research, you cannot go for any conferences, nobody sponsors you for anything. Only after a series of strike did the residents get the Residency Training Act passed. Even then, it is through the will of the Mr. President and the member and the Speaker of the House of Representatives that this act has been made operationalized, So the truth of the matter is that we need to be more serious with policy implementation, which is actually one of the setbacks of Nigeria. I was in the Nigerian Institute of Medical Research. I was in the National Institute for Policy and Strategic Studies 25 years ago. We wrote, each person will write his policy issues, his research, conduct research, and bring out what he thinks it should be necessary. In that research, I proposed that Nigeria should have a bank for health because maternal mortality, that deaths in pregnancy and childbirth was quite high. And we found that there were so many things that could have been done to stop the deaths in pregnancy and childbirth. As you know, pregnancy is not a disease, and no woman should die bringing forth life. We proposed that and we gave reasons. One, if you look at, because I'm sure we'll be talking about medical tourism. If you go to India, all the Indian hospitals that Nigerians go to spend billions of dollars are run by private organizations, private sector. And if we have bank for health in Nigeria, we will then give loans to private practitioners at single-digit interest rate, and they will establish the state of art in the specialties of cardiology, nephrology, and other conditions, and either in Abuja, Lagos, Port Harcourt, Kano, as the case may be, such that we do not have any reason to go abroad for anything. Training in Nigeria is superb. We can continue to improve on it. It's a continuous thing. But the reality is that the policy implementation is very poor. And unfortunately, too, those who are in position to implement policies are not many.
Hello, Prof.
But it was an act of patriotism, and I have no regret for that. But it's also true that the environment is Boko Haram, kidnapping, raping, armed robbery have taken over the space, the Nigerian space, and nobody wants to live in insecurity. Some people have their children. Look at the doctor, among others, the doctor that was killed in Kaduna. The doctor's wife that was killed. There's no reason at all. And
okay, Prof. Hello, Prof. Can you hear me, Prof?
No reason to do that.
Hello, Prof.
But that happened.
Hello, Prof. Can you hear me?
In Kaduna and Abuja Road, they are killing by the day. So there's insecurity in Nigeria, and we need to come. We know that the security agencies are doing the best, but their best could be better.
All right.
Because nobody wants to live in insecurity.
Indeed.
And insecurity brings, brings down development. It stunts development. So that is why, if you like, in fact, the PLAP that is done in the United Kingdom, Nigerians will troop out by numbers very soon. It's just because of COVID-19. And many of Nigerian doctors, house officers, will finish their training. The doctors will finish their training and don't have a training post to do house job. Then what would they stay in Nigeria for? But as a president of Nigerian Medical Association, I will advocate, I will discuss with government so that they can look at it properly, and so that there will be implementation. One of the things that we just got now is the fact that there will be a central pool for house job. Now, Residency Training Program Act is being implemented. It's not foolproof yet. And then, of course, people should be employed, and the budget office should allow people to work rather than saying they have not approved and you cannot employ. I think there's a disconnect between the budget office and the end users. So they need to listen to those who are in position, because they are the ones who are at the receiving end.
All right. Thank you very much, Prof. Honestly, there's so much to really engage you on. When we have to look at how well the health sector is faring in Nigeria. And obviously, political will on the part of the government will go a long way to making sure that we have what we should have in the health sector. Okay, in the course of your, while responding, you did mention India and the fact that private sector were the, one dominating there. Of course, one of what I was going to take you on was that the fact that why can't we have private sector doing the same thing here? But of course, you have said something about it. A lot has to do with political will, like I said, the government providing facilities and all of that. So that is well taken. But I want to quickly still take you up on that brain drain that you started with. Now, you did say that it's quite expensive to train doctors. And of course, in Nigeria, they are well trained here. And of course, with Nigeria hard-earned resources. Now, Prof, would you say, is it morally right, having trained doctors here, for them to leave to other climes to give their service using Nigeria hard-earned resources to train them? Is enemy not concerned about this? And if you are, what are you doing to reduce that? Hello, Prof.
Well, if we say we are not concerned, then we are is the foremost.
Yeah, I'm asking if you are not concerned about this brain drain.
Noble profession in Nigeria, we are concerned.
Okay.
But you see, we have limitations. The best we can do is to advocate, is to let government know constructive engagement. But we have no force of law.
Okay.
Because we are not a government. Our own is to advocate, and then let the government, listen to us. They should take our advice, because I'm happy that this President Buhari, during the COVID pandemic hike, said that we should listen to medical experts. And I think that we should be able to listen to medical experts.
Okay.
Unfortunately, many people do not think so. I mean, everybody thinks that as a doctor. Everybody cannot be a doctor. You must go for the training.
Yeah.
You must go for the discipline. What we go through in medicine is such that we should be concerned that Nigeria trains so many, and yet they find their way out because of the harsh operating environment. And I believe that we need to constructively engage government so that many things that are not doing well can be discussed, and then strategies for improvement can be put in place.
All right.
We cannot say that they are not doing anything at all.
Okay.
But we are in hurry.
Okay.
It's like race against time, because at this moment we should not be talking about mundane issues in healthcare. But unfortunately, if you talk about people are put even ordinary anti-malaria, we can't get many basic things we cannot get. Look at the issue. We getting reports from the southeast and even from some part of Benue State on yellow fever. Why would we not have yellow fever vaccination across the country? Why do we have to wait? Issue of Lassa fever. We still have Lassa fever. When we know the epidemiological characterization of Lassa, that Lassa fever starts in the in the dry season. Why would we not start our jingles, National Orientation Agency, starting its jingles to educate people from August that it is coming? And then, of course, we need to continue to see how we can prevent some of the factors that will lead to people contracting the Lassa fever.
Okay.
So we are riddled with communicable and non-communicable diseases. Maternal mortality ratio is very high. Infant mortality rate is very high. Neonatal mortality rate is very high. So nothing really is, as far as we are concerned, we have not invested in health. And if we have not invested in health sufficiently, we cannot get the best.
All right. All right, sir.
The system.
All right. All right, Prof. All right, Prof.
I want to plead with media to educate the government also, and people in power, to improve the health circumstances of our people.
All right. Thank you, Prof. That is well said and well taken. Thank you very much, Prof. In the course of my research, I found out that you have been involved at the highest level of policy formulation concerning some of these diseases you just mentioned: Ebola, Lassa fever, yellow fever. In the course of your active service to your profession and to the nation. Now, talking about research, I gather that your members are, in numbers of over 40,000 here in Nigeria and up to about 19,000 in the diaspora. With the exodus of doctors out of the country almost on a daily basis, seeking better working environments and all of that out there, Prof, do we still have enough doctors to, service our health sector in Nigeria? And if yes, what is the ratio of doctors to patient population in Nigeria? What, in addition to that, very quickly, because we are running out of time, in addition to that, what should be the ideal ratio of a doctor to a patient in Nigeria? I hope you're able to get all the questions.
Well, thank you very much. There's no way we can have enough doctors in Nigeria. In fact, Europe and America don't have enough doctors. That's why they are actually getting our best brains to go and support them. We continue to train. We continue to train. We don't have enough. And the ones we have, they should have their conditions, place conditions that are conducive for them to work. Equipment, facilities to work. The infrastructure should work. Roads should be good. Water should be available. And then, of course, light should also be available. These are things that we now it is true that many Nigerians are in Europe, America, and many other countries in the world where they would train, they would do their work to their satisfaction, have a satisfactory job satisfaction. They will also have the ability to train their children and look after their wives or husbands, as the case may be. So nobody wants to continue to suffer and be subservient. You can't have a very highly trained manpower and then they will be at home 3, 4, 16 months. As I talk to you now, there are some states that have not paid salary for 16 months. Doctors have not been paid for 16 months, other 4 months. Well, how can that happen in a country like this? So having said that, those are the factors. Nobody wants to stay and be a beggar. A doctor, highly placed, highly trained person will be begging. Somebody, maybe a local government local government councillor who probably has only secondary education. You come and talk to you as if you are nothing. Nobody wants to do that. There's a pride, that we will have to show in medicine. There's no truth about that. The second thing is that at the moment, the doctor-patient ratio in this country is 1 to about 5,000. And it varies, maybe in a place like Lagos. But if you go further north, that ratio can be up to 10,000 because of the lack of doctors in those places. The WHO talks about 1 doctor per 600 persons. And it is very difficult, be mirage for us to get that the way we are going. Because we have to sit with government. Let's discuss with government. When we say government, nobody have an illusion that it's only the federal government. We have state governments who are elected in their own rights, and they should be responsible and responsive to the healthcare of their people, rather than everything being pushed to the federal government. They get allocation just like the federal government. But unfortunately, many of these states depend on the federal medical centers where there are no teaching hospitals. Where there are teaching hospitals, they depend. Some of the states don't have up to 10 doctors or 20 doctors. The primary healthcare facilities are not manned by doctors. And this is one of the reasons why we cannot improve our health indices. So by and large, we will not have enough doctors. If Europe and America cannot have enough doctors, we will not talk of any country in Africa, not even South Africa, that will have enough doctors, because the demand for doctors and specialized care is very, very high. And we should work towards getting this sorted out. Unfortunately, I have not seen anything on ground to propel us to ensure that we will improve on whatever we are doing to improve the health of Nigerians. The Bank for Health must be established if we want the private sector to participate. Public-private partnership should be properly refined so that it can cater for our people. And if we do this, I tell you, just give ourselves 5, 10 years, we will be home and dry.
Interesting, Prof. I mean, it's good to know that you are wearing double cap as sitting on the side of the government and as well representing your your association. So I want to believe that you'll be able to engage the government well, so that you can have much of what you hope for to have better healthcare in Nigeria. Now, you said we according to WHO, you're supposed to have a doctor to 600 patients, but what we have here is the very minimum 1 to 5,000 patients. That is scary, Prof. And I'm wondering, there are, do I say young doctors that just finished their medical school that are waiting for their housemanship. Many of them, there are instances where they are seated at home because they cannot get a place to do their housemanship. I'm just wondering, I mean, is it that we don't have enough teaching hospital that will absorb them? At least this will should be able to complement, your service at that level. At least they should be able to help at the OPD level, at the outpatient department, at least to attend to some patients, and that will make the job a little lesser for you people. Do you get my question? I'm just wondering, why is it that we don't have enough teaching hospital to absorb these people?
In fact, you don't need a teaching hospital to train house officers.
Okay.
What you need is general hospitals, federal medical centers, and also teaching hospitals. The state governments are not doing enough. If many of the state governments, many of the states, they don't have a functioning general hospital. All you need is to have a good general hospital, functioning general hospital, with consultants in the 4 main areas of surgery, obstetrics and gynecology, pediatrics, and internal medicine to train house officers. And
hello, Prof.
The Southwest, many states do not in that they can train house officers. And this is something that we have to advocate to the Nigerian Governors Forum. Let them improve their general hospitals. Let them not depend on federal government alone, because at the moment, they depend on federal government through the federal government, federal medical centers, or teaching hospitals. And they say that to pay doctors is very expensive, but that's a contradiction. A doctor who is well trained must be paid for. And I believe that they should prioritize the health of Nigerians, of their people. When they are campaigning, they say they will provide health services. How they will provide, they don't tell anybody. What is the vote? Nobody knows. When you vote them, that is the end. They don't think any other person exists. I think that the Nigerian Governor Forum should sit down and do peer reviewing mechanism, compare themselves with some states. Particularly, some of the states in the Southwest are doing well. There's no two way about that. And they should look at that as a peer review mechanism so that they can ask questions, how are they doing well? And what should they do to do better? And in that case, you find that things will improve. But the situation where there is no priority to health, and the general hospitals are just there like that. Some of them are even used for primary healthcare facilities, are used for storage of sorghum, rice, and maybe yams. And I think that is a disgrace. Nobody should hear that, but that's the reality on ground. So the truth of the matter is that, and the good thing is that at the moment, the federal government, working with NMA and the Medical and Dental Council, is centralizing the training of house officers so that they will be posted from through the Medical and Dental Council of Nigeria to the various states, various facilities. But it's also true that unless we expand the training facilities by improving the general hospitals in the various states, we will not be able to get all the house officers in training, because so much to be a doctor and
hello, Prof.
to manship, which is a prerequisite for you to become a qualified medical practitioner. And we hope and pray that this will come to pass.
Okay. I say amen to that. Thank you very much, Prof. our time is, it's fast spent. But let me quickly take you on issue of COVID-19. You did mention some of it, but I want to take you specifically on this. Your emergence as the current president of the Nigerian Medical Association came during the height of the COVID-19 lockdown in May 2020, and you happen to be the first ever president to be elected virtually, due to no thanks to COVID-19. I want to ask you, as a researcher and the former DG of the Nigerian Institute of Medical Research, what are you doing? What are you doing, Prof? What are you doing with your members, NMA, to find and other researchers to find lasting solution to COVID-19 in Nigeria, especially with the new wave of infections that are being recorded in other climes? And of course, the numbers are gradually rising again in Nigeria.
Well, the issue of COVID, let me just say that we want to thank God for sparing our lives, because COVID made us to know that we are naked in terms of our preparedness, the health system, level of weaknesses in the health system, and the level of unprepared status of Nigeria to tackle the issue of COVID. We are not ready. But then we confronted this. Initially, as you know, we had only 2 PCR machines in this country, one in Lagos, one in Abuja. But today we are told that we have over 60. How many of these are functional? What training have we given to those in the lab to do these tests? Those are other things. Now, the truth of the matter is that the COVID was taken as a joke by Nigerians. Many do not believe that it exists. In fact, they will tell you it doesn't. Or going to the bank.
Hello, Prof.
The face mask. And the NCDC protocol says that we should wear face mask, we should do our hand washing and then use sanitizers, social distancing. But Nigerians, are very pessimistic, and we think we know so much. All those basic protocol requirements are not being complied with. So we continue to work, and the NCDC and the PTF are working, but we need to support.
All right, Prof.
We must continually inform and educate the public.
Thank you very much, Prof.
Traditional institution.
All right, thank you so much. Thank you, Prof.
People know that.
Hello, Prof.
For a second wave, otherwise we'll be wiped out as a country.
Hello, Prof. Thank you so much. Thank you so much for your time. Time is, we certainly have run out of time. I must thank you very much, Professor Innocent A.O Ujah, MD. Thank you very much, a fellow of Medical College of Obstetric and Gynecology, fellow of Nigerian Medical Association, the president of Nigerian Medical Association, as well as the vice chancellor of the first ever university, Federal Medical University in Nigeria, in Otokpo, Benue State. Thank you so much for your time. We really appreciate your time with us, and we hope that when next we call on you, you oblige us. Thank you, Prof.
Thank you very much, and I'm delighted. We prepare to work together to improve the health of Nigerians.
Beautiful. Thank you so much, Prof. All right, that is where we'll draw the curtain today on Close Flow. Thank you very much for your time. Join us some other time for another engaging session on Close Flow. I'm Kazim Adeyemo. Bye now.